Most people think supplements work instantly, but the human body doesn't work like that. Ashwagandha is one of the most misunderstood supplements because its effects depend on how the body responds to stress over time. Ashwagandha, also known as Withania somnifera, is commonly described as an adaptogenic herb. Adaptogens are studied for their potential to help the body cope with stress, rather than stimulating the nervous system like caffeine. To understand why ashwagandha is studied, we need to understand cortisol. Cortisol is a stress hormone that follows a daily rhythm. But when stress becomes chronic, this rhythm can become disrupted. Research shows that dysregulated or elevated cortisol is associated with poorer sleep quality, daytime fatigue, and impaired recovery. Several randomized controlled trials show that people taking ashwagandha report significantly lower perceived stress scores compared to placebo. Some of these trials also show reductions in cortisol levels. Because cortisol and stress influence sleep, it makes sense that sleep is one of the first areas people notice change. Research reviews analyzing multiple clinical trials suggest that ashwagandha supplementation is associated with improvements in sleep quality, especially in people experiencing stress or anxiety. Now let's talk about testosterone, because this is where online claims are often exaggerated. Ashwagandha is not testosterone replacement therapy. It does not directly act as a hormone. However, research suggests an indirect relationship. Chronic stress and poor sleep are known to negatively affect hormonal balance. Some studies in physically active men show that ashwagandha supplementation, when combined with resistance training, is associated with improvements in strength and recovery, and in some cases, increases in testosterone levels. These effects are likely secondary, meaning they occur because stress and recovery improve, not because the herb directly forces testosterone higher. Dosage is another important detail. Most clinical studies use standardized ashwagandha extracts, typically in the range of 300 to 600 milligrams per day. These doses are taken consistently, often for 6 to 8 weeks. This is where expectations matter. Ashwagandha does not work in days. Most studies measure outcomes after several weeks, commonly between 2 and 8 weeks of regular use. Ashwagandha is not safe for everyone. Health authorities advise caution or avoidance for people who are pregnant, have thyroid disorders, autoimmune conditions, or liver disease. There are documented case reports linking ashwagandha supplements to liver injury, although these events appear to be rare. So here's the evidence-based takeaway. Ashwagandha has its strongest scientific support for reducing stress and improving sleep quality. Any testosterone-related benefits seen in studies appear to be indirect, linked to better stress management and recovery. It can be useful when used correctly, but it is not a miracle supplement. If you want to explore the science yourself, all research papers mentioned in this video are linked below in the description. This is NatureX Science.